much for having me in your session. Uh, the talk which I'm going to present is related to or is entitled as COVID-19 and its impact on families. I will discuss the psychosocial perspective with reference to this novel phenomenon. As far as we all know that it is a pandemic in all over the world, and as a psychologist and as an educator, I feel that the disease or the health and disease both are family affairs, whether it is related to the physical health or it is related to the psychological health. Both the things are related to the family affair. And in Pakistan, it impacted, its influence on the families in the Pakistan is very much drastic in nature. It influences not only to the structure of the family, but also to the functioning of the family also. Like it is related to the day-to-day dynamics, which are impaired nowadays. People who are living in one house or in one roof, they are basically afraid of each other. And number of things are related to the feeling of uncertainty. The feeling of uncertainty is related to the disease itself and its effect also, like its effects on the finances, its effects on the socio-economic well-being, and as well as on the mental health and other kind of issues which are related to the day-to-day living. As far as we are observing people, we need to observe people in different kind of aspects. Like we are looking how families are adjusting uh, their day-to-day dynamics under lockdown or quarantine or in isolation, and how people or parents are striving for their work, whether they are working from home or whether they are working at their offices, and how they are managing their child care, and how they are treating their children in order to adapt with the new home environment, because everyone, most of the time, everyone since March, we are at home, and the children are really allowed to go outside, and it is very difficult to handle children inside the home in this kind of confinement. And we feel that as an adult we can adjust our life in the time of the crisis, but it is difficult to communicate a different kind of adjustment to the children for their well-being. Right now, the families, the impact which is on the family is the feeling of uncertainty, which I have said earlier, that they are facing different kind of unpredictability in life, and they are waiting for the normal life. And when we are waiting for the normal life, we all know that this will not be a new, not be an old normal. The terminology which we are seeing or facing is the new normal terminology. And for us, the new normal is, for me, not for us. I dig out number of things with reference to my life and explore different things with reference to my day-to-day dynamics. I feel that this new normal will not be a new normal, or a new, not be a normal itself. It will be little bit an abnormal kind of situation. And when we are saying that it will be an abnormal kind of situation, it means that we need to restrict our relationship or interaction with people. No meeting, no greetings, no hugging, no close sitting. So we need to be afraid of each and every person who is available in our life. And this kind of a situation definitely induces stress and anxiety. And this kind of situation gives gives a sense of powerlessness and helplessness in my society, because we are living in a very cohesive social network where everyone is always available for emotional support, for physical support, for other kind of esteem support, in fact. And we have a different kind of manifestation for social support. We are not only communicating to each other, we are basically providing physical support in terms of esteem or in terms of emotional manifestation. So we have a different kind of manifestation in our society. And like, for example, we are restricting ourselves to hug, and we are restricting ourselves to shake hands. This is a very common phenomena in our society, and most of the time during the COVID, people are very much uh, uh, pressurized to do these kind of activity, but then they realize, no, this is COVID, and they restrict themselves in order to have this kind of social support or supportive manifestation. And another thing is basically that families are very much concerned about their loved ones, because this disease have some impact. It reduces our interaction. It is insisting us to maintain social distance, and our society is not very much uh, uh, accepted, very much allowed to accept these kind of things. And the whole family and the families are usually under pressure. And when we are under pressure, we see that this lockdown and quarantine measures, which is instituted in our culture, it is inviting vulnerability and risk within the family. The schools are closed, and people are in distress. Everyone is at home, and we are very much uh, what we said, we are very much under stress when we are dealing with the people who are elderly. We are dealing with the people who are with the disabilities, and the children who are suffering from MR and other kind of problem. So families with a child who requires a specialized care and guidance, they are basically unable to do these kind of things out of the home. And they are basically depriving these things from this kind of attention. And the families who care for father, mother, and partner with dementia or other kind of serious illnesses, now they need to manage these things without daycare or daytime activities. And sometimes we also observe that the children of the divorced parents are also facing the same problem, that they do not have alternate parental care, because one of the parent is working from home, and he or she is not providing the child care facilities to the children. And all of these families and their interrelationships are often under great pressure as a result of this kind of COVID-19 stress, which is embedded in our society. So this new world, which need a new way of adaptability, a new way of understanding or reconceptualizing the thing with reference to the day-to-day dynamic, definitely impaired our functioning also. Although we are in a very cohesive family, but in the cohesive families, we are, when we are in the isolation and in quarantine, the stress is so much immense in our personality or in ourself. So we don't have any kind of coping devices. So we need to develop some kind of supportive mechanism within the family. And that's why the children are witness for domestic violence. The children are witness for different kind of aggression and abusive relationship within the family. This is the phenomena which is available across the Pakistan and also in the Pakistan, both. It is a very common phenomena which is available everywhere. Yes, we can have certain thing, one thing more, that we do feel that the people who are living under one roof, they are also suffering with different kind of psychological disturbances, like depression, anxiety, post-traumatic stress disorders, and psychological symptoms like obsessive compulsive disorders, which is because of repetitive hand washing, or repetitive checking of temperature. So these are the symptoms which we are facing nowadays. People are concerned with the financial problems, because this is not a very rich country. In Pakistan, most of the people are relying on the salaries, and when the organizations are closed, when they have downsizing, when they it is not not an available phenomena in the state governed organization, but in the private sector it is available, that people are using downsizing, people are stopping their salaries. So the financial crisis is very much. But apart from these things, the people who are suffering from different kind of psychological symptoms, uh, in Sindh, we have a very good initiative with reference to the local government of Sindh, and the collaboration with the UNDP, United Nations Development Project. And we introduced 1093 helpline, and that 1093 helpline facilitates psychosocial support interventions for those families, for the families who are suffering from any kind of problem, whether they are suffering with the illness, or they are suffering with the quarantine or lockdown issues, or other kind of problem. So we arrange psychological support, we arrange referral supports with reference to the doctors, gynecologists. Doctors means general physicians, gynecologists. We introduce telemedicines here, the concept of telemedicine in the Sindh. And then we introduce a little bit job opportunities with reference to one institute which is known as Silani. The Silani is one of the organization which is providing rations to the food and the grocery item to the people, to the families, for their economical affordability, as well as they are providing odd jobs for those people who are unemployed in the context of the COVID. And as a psychologist, I have 150 psychologists in my team, and they are providing telecounseling for young, for children, and for older people. It is amazing that the youngsters, the teenagers, are complaining more or have more effect of COVID-19 rather than the children. In children, they have a very good kind of adaptability. I observe that they have a very rare children are reporting a symptom, but here the children are reporting very good kind of adjustment. They are engaged in different kind of activities, in creativity, in drawing, and in indoor games activity. We also introduce little bit competitions and other kind of activities in order to engage the children. One of the organization in Pakistan, Colgate, which is an international brand of toothpaste, they also announces some competition, drawing competition. This is same with the kangaroo maths competition. So the children are happy, and uh, basically they are making good kind of adaptation as compared to the teenager and as compared to the uh, elders. Women are reporting symptoms here, and they are reporting symptoms with reference to the helplessness and powerlessness. And they have irritability in mood also. They are facing emotional exhaustion more here in Pakistan as compared to the other age group. Uh, the family is also suffering one more issue with reference to the stigmatization, because in the here we have one the cordon off kind of thing in order to quarantine the people within the community. So the family is uh, relatively vulnerable with reference to the discriminatory kind of behavior from their neighborhood. And sometimes they are facing the workplace prejudice even after they recover from the COVID-19 phenomena. A little bit more about the practices which uh, we are facilitating here is we are facilitating awareness programs, we are facilitating telecounseling, telemedicine, and some coping strategies, like the building their resilience, and fostering good kind of communication between the people. We are working on the mindfulness, and we are working on the psychological crisis intervention. We prepared number of volunteers for uh, 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 this kind of services. And this kind of psychological crisis intervention which we are providing is basically focusing on the behavior modification, because the adaptability is impaired. Everyone is at home, and everyone is basically, uh, we have both kind of thing. We have the people who are at home, they are sometime governing their life with good kind of support, with the good kind of relationship. But we have one more indication in the society, that they are abusive with each other, they are aggressive and in conflict with each other. And that's why, although we have a very strong social support network, so the divorce rate is not very much reported. But yes, we need to believe that there are number of unreported cases in which we are for which we are facilitating services, and we are managing their relationship, uh, uh, both of the couple, husband and wife both, that they need to focus on their rebuilding of the relationship rather than breaking of the relationship. So we are sketching certain skills for them. We are using different behavioral modification techniques. We are cultivating positive emotions in them, and we are focusing on different kind of coping strategies in order to improve their mental health. And one thing more that I need to share, that what we expect, that after COVID-19, like I don't know when it will be over, but right now, when the disease has less reported cases in Pakistan, now it is on the diminishing curve. Now people are very much feeling better, as they feel that the threat is over and the things are better for them now. They are meeting with the people, although they are maintaining their SOPs. Some of them are also violating, but most of them are observing their SOPs. They are meeting, they are improving their mental health by socializing. They are doing their shopping for their essential. And to most of the people, I always insist and I always suggest them to use their money only for essential. And we are very much successful in convincing people to use their money only for essential, like for the survival needs, for grocery, not for the non-essentials like clothing and other kind of electronics, etc. So they are able to manage their money with reference to their day-to-day living, and that is giving them a very good kind of peaceful mindset. And they are focusing on fostering the relationship. And when they are fostering or improving the relationship, so it means that they are now what we work for them. We train them for the kindness, we train them for emotional recognition and emotional management. We insisted to observe the routines, the day routines, like daily bath, some work for from the home, and some reading, some hobbies engagement. And we insist to have fun together, take tea together in the evening time, have meals together, and try to communicate in a very open manner, in a very less conflicting manner with the people who are around them. So this is from my side. I hope I might be clear in communicating the thing. If if something is unclear, please do ask.